Hello, today we'll discuss the visualization of healthcare data. Um, Before we start, let's have a quick little background of this project. So during the beginning of the COVID-19 pandemic, many healthcare professionals were trying to find a particular cause or indication of what factors increase the mortality rate of patients that were infected with COVID. Due to the alarming rate of viral transmission, healthcare professionals utilized every tool possible to assist with making correlations between other factors that can lower the chances of survival of the patient population. These factors include age, gender, and diagnosed comorbidities. While searching for these factors, healthcare professionals required a way to quickly communicate all findings as well as make rapid findings while conducting research and treating patients. Data visualization is a tool that converts data into graphs, charts, or maps. For this particular reason, this is the best tool available for this type of research. The graphs used for this presentation have been reviewed to have the ability to differentiate the many types of information provided by color, as well as provide numerical data that can assist all users, attracting their attention visually. The data that we are using was obtained from an EHR. I cannot disclose where that was from. All I can say is it's the EHR from a hospital. This hospital was conducting live research and reporting out, and they were trying to do the best that they could. For security reasons, they did remove patient identifiers, and they kept reporting their live results. They also had a way to govern this issue. So when analyzing and creating graphics, there were two main considerations were the privacy and security of the patient's data. The first concern was inadvertently creating a vulnerability to raw data. Essentially, while creating these, or while searching for data, creating the specific queries, there's always a chance that the data that we're using could be exposed due to being connected to the wrong internet ISP or internet service provider. Some providers, they data mine. This has been reported. This already has been, it happened before. So that was one major concern. At some point, patients do have identification issues, so that was a big thing. The second consideration was the privacy risk. The issue was resolved by establishing a governance policy within the organization of who can access this data and who has access to the desktop that is capable of accessing the current data. The reason being is because while doing research, there could be a chance that you may have to keep looking over. Some types of research you want to keep in-house until it has been vetted, and basically everyone has approved of it. You don't want certain research to go out or to the public when you're not sure what you're reporting just yet. So data governance played an important role when designing the infographic obtained. The infographic that we use was required to inform the public of the found comorbidities, as well as a tasteful way to catch the eye of the public. During the initial outbreak of COVID-19, we tried to do as much as we could to let them know what precautions that they should take, what we should do. So let's forward. In this slide, this is our proposed dashboard. This dashboard was meant to provide real-time data to departments working on COVID-19 research as well as providers. In this particular dashboard, I'm actually going to bring up the full dashboard for you here. Resize the dashboard. Okay, I can't resize the dashboard for you. In the dashboard that we have, we were able to show the comorbidity that they have. We were also able to show the explorations that occurred. So from the data that we have, the highest comorbidity associated with COVID-19 was hypertension. But it was also it also showed that most people, or not most, but there was also a high amount of people who had no comorbidities, and they expired as well. There were some explorations with cardiovascular patients, patients with diabetes, patients with respiratory distress, COPD, stuff like that. Surprisingly, the lowest were cancer patients as well. Cancer patients were considered during our research to be the highest amount of patients that would actually succumb to COVID-19 due to their immune system being compromised, but in actuality, from our data, it was not. We also looked at the age of individuals. So from the data that we obtained, the young people that were younger, they did contract COVID-19, but they weren't expiring or they weren't dying from it. That has changed drastically now that we know, but this is from the research that we have here. The total patients that we have out of 5,000 patients, 324 people with hypertension passed away. Now, what changes the data for me, in my opinion, is the numbers here. So, out of 34,276 patients, 303 patients passed. So, this can be from these patients that passed, these patients did not have any comorbidities. So that actually changes the amount for the research that we have here. I'm pretty sure if you do the division, you can see like, hey, patients with hypertension do have a higher death rate than anyone else if you compare the data. Actually, it's more. It's patients with hypertension, it's patients with cardiovascular diseases. Diabetes, it's a little high, but not really too much to be alarming. Same thing here with cancer. Cancer, not too much, in my opinion. We would have to do more research to gather something. I also have an infographic here. With the infographic, this infographic was for the public, as well as our physicians. Our physicians and actually all healthcare workers, please wash your hands. Let them know that, hey, there is a clear association between comorbidities and mortality rates, to let them know if you have a patient with comorbidities, maybe there's a way that you can start sending them a notification that for vaccination, things of that nature. This is the reason why this should be handed out to the public. Pretty much this is all my data that we have taken for this. Thank you for your time. You have a great day.